You can catch herpes virus from people who haven't got any outward signs of herpes. In fact, it's a very common way to catch herpes. So people whose skin looks totally normal can still have the herpes virus sitting on the skin, and you can contract it from them. They may not even know they've got the virus. They may never have any symptoms of the virus. They may just be carriers of the virus. Herpes simplex virus, or HSV, is a quite common sexually transmitted disease. It's contracted by skin-to-skin contact, so if you have skin contact with someone who's got the herpes virus, you can catch it in this way. You can also catch it from oral sex, so if somebody has cold sores around their mouth, or that virus, the HSV virus, and if they give you oral sex, you can catch herpes in this way. It normally would present with ulcers in the genital area or around the mouth, or it can just present with sort of smaller, like sores that are sort of in more linear, like a line as well. There's two types of the herpes virus, type 1 and type 2. Type 1 is generally associated with the oral herpes, the cold sore virus, and type 2 always historically was associated with the genital area. But in certain countries, like in the West, we're seeing more and more patients who present with genital lesions that are due to herpes type 1, the cold sore virus. Essentially, they present in pretty much exactly the same way, so with the painful ulcer. But generally, the type 1, the cold sore virus typically, has less recurrences and can potentially have less severe attacks. And type 2 tends to have slightly worse attacks that can come back more frequently. Herpes is normally diagnosed by doing a swab test, a skin swab test. If the skin is normal, you can't have the swab test, but you need to have an actual lesion to do the swab test. It can be treated using acyclovir, or one of the sister drugs of acyclovir, which is an antiviral drug. And this can help relieve the symptoms, particularly of the first ever attack. So herpes can't be cured. Once you have herpes in your body, you keep it in your body. But what happens is the body becomes able to control the attacks, so that with time, people generally have fewer attacks, and the attacks get less and less severe, to the point that people can have an attack and don't even know they're having an attack. And then what often happens is people stop having attacks altogether. If people do suffer with quite severe recurrent attacks, if they're getting attacks, for example, every few months, then we can put people on treatment to take every day to prevent these attacks coming back. You can catch herpes virus from people who haven't got any outward signs of herpes. In fact, it's a very common way to catch herpes. So people whose skin looks totally normal can still have the herpes virus sitting on the skin, and you can contract it from them. They may not even know they've got the virus. They may never have any symptoms of the virus. They may just be carriers of the virus. Using condoms can help decrease the chance of passing on and catching herpes, but condoms only protect the area that they cover, because it's sitting on the skin, the virus. So they're not 100% effective, but certainly better than nothing.